problem of childhood obesity has only worsened over the decades. In fact, in the past 40 years, obesity rates have tripled in children and quadrupled in adolescents.
Well, now the American Academy of Pediatrics has issued its first new guidelines in 15 years to aggressively address this problem. Dr. Frank McGeorge is here with what you can expect from your child's pediatrician the next time you visit.
Yeah, exactly, Kim and Devin. So, childhood obesity is a complex mix of genetic, social, economic, and environmental elements. And finding the cause and then treating it, that's a challenge. But these new guidelines provide a starting point for earlier intervention, which is better than the old watchful waiting.
I have definitely seen obesity rise and continue to rise in my practice and as I've grown up myself personally.
Dr. Tiffney Widner is a pediatrician at Children's Hospital of Michigan, and she welcomes new guidelines from the American Academy of Pediatrics.
What these guidelines do are to help to kind of guide our treatment of obesity. We know this is a wider problem. It is a multidisciplinary issue, and we have to attack it from that vantage point. So now we're saying, okay, not just monitor, not just lifestyle changes, but let's enroll these children in programs that will more intensively attack their obesity as a problem.
That means you can expect your child's pediatrician to begin earlier monitoring and intervention if your child is overweight or obese, starting with motivational and behavioral treatment as early as age 2. And new to the guidelines is the addition of medication and surgical options.
Usually, bariatric surgery is considered with children that are greater than 12 right now. And right now, the medications are leaning more towards those that are 12 or older. What we're trying to do is change the mindset of the individual children so that we can have them think about food in a more positive way.
Now, across all ages, the first approach is always going to involve behavioral changes and identifying what can motivate the child and their family to make positive changes. Studies have actually found this is most effective when it includes, of all things, at least 26 hours of face-to-face counseling over a year.
Oh, and she mentioned bariatric surgery for children.
Yeah.
Like, we all kind of gasped when we heard that. Now, for older children, when it gets to the point of surgery or medication, how financially feasible is that?
Well, that is a real problem because, quite frankly, while these options may be offered by a doctor, many of the medications, frankly, remain very expensive and probably aren't going to be covered by insurance. Even surgery may not be covered in all situations. Hopefully, though, as these guidelines become more adopted, insurance will be more open to covering them.
Some of these new medications are showing an awful lot of promise, but they're out of touch if you can't afford them. Yeah.
That's exactly it.
Thanks, Tom.